Hello and welcome everyone to our final installment this year of Office Hours with Dr. Kelly. And today we've got a very special guest in Dr. Katie Eklund from the University of Wisconsin, who's going to be talking to us about universal screening for mental health and behavioral health in schools. So without any further ado, we'll review the schedule real briefly, the agenda for today's presentation. I'll give you a brief background about eLuma, and then we'll launch into the presentation discussion. So first and foremost, we'd love to just talk about what the schedule is today. For some reason, there we go. Our agenda for today, we're just going to do a brief introduction, then we'll dive right into this presentation. That's why you're all here. And then we'll have hopefully a very lively and interesting discussion with Dr. Kelly and Dr. Eklund. And at the very end, we've reserve some time so that we can answer your questions. So with that, I want to remind you that there is a chat feature at the very bottom of your Zoom screen. If you have a question, when you have that question, please put it in the chat, and then we'll come back to it in this latter portion of the presentation. I also want to remind everyone that we have closed captioning available through your Zoom program. You can access your closed captioning through the live transcript button at the bottom. All you need to do is click enable, and it will deliver real-time closed captioning for you. So let's just tell you a little bit about who we are. I'm guessing most of you have been here with us at some point in the series, but if you haven't, my name is George Dayton. I work with eLuma, and we are dedicated to solving problems in the areas of special education and mental health for K-12 schools. And if you'd like to learn more about what we do, either so you can come work with us, we're always looking for great people, or if you need support at your school or district, we most definitely stand ready to help you. I know there are lots of challenges with compensatory services with lots of schools all around the country. Also want to remind you that even though this is our last webinar, we've got more coming. We plan on having Dr. Kelly come back and lots of other interesting guests like Dr. Eklund. So if you like this webinar, follow us on Twitter. We're at eLuma Therapy, or you can follow us on Facebook, and we'll keep you updated with all of the latest. We've got lots of other great content, whether you're a clinician, whether you're an administrator, it's great stuff. So I don't want to eat up any more time. You didn't come here to hear me. Let's turn this over to Dr. John Kelly.
All right. Good afternoon, George. Thank you so much. And this being our last conversation for this series, I do want to again give a special shout out to you, George, for being a great partner in this entire series, and certainly to eLuma for their support of not only the work that we do in the schools, but just in general in education. One of the things I love about the work that you do, George, and eLuma is you give back to the field and you give back to the profession. And I just want to thank you for that. Kind of acknowledge that. This is our last of a series. I'm thrilled for tonight because I have a good friend. I'm going to introduce her in just a moment. But as typical with kind of online virtual things, you might have to forgive us at some point tonight because we all seem to be having technical issues going on. And I'm not sure what's going on in the technical world, and what's happening out in the universe at this point in time. But, if we start to have some little glitches here and there, kind of hang with us and we'll make everything work. It's all good. So yeah, I see my good friend Peter Faustino posting solar flares. Maybe, Pete, I really don't know. But no, this has been a wonderful series. It's Conversations with Dr. John Kelly. Welcome you into my office hours. It has been a wonderful series. And Katie, if you can go to the next slide, I do want to kind of move forward and kind of introduce you because Katie is a friend, and I'm proud to call her a friend. We've known each other for many, many years. I knew Katie when she lived out in California, Colorado, and now she's in Wisconsin. And in fact, Katie, and I hope this is okay to, I don't know if Steve is watching, but I was actually in on one of the first dates with Katie's husband. And I apologize, Katie, I don't want to embarrass you or Steve or anything, but they're great people. They're a great couple. But I love the work that they're doing together. So tonight we're going to talk a little bit about screening in the schools. And I have to be honest with you, I read a recent article that talked about Mental Health America, the organization Mental Health America, and how they recently reported that the screening that they make available online is a free screening process they make available online. And they reported that youth between the ages of 11 and 17 were more likely to score positive for anxiety and depression than any other age group in their online survey. And that since 2019, the number of people taking their online screening has gone up by 500%. I think it's just symptomatic of what's going on in our world and in our country. And so that's why I think it's important for us to talk tonight. Katie is truly an expert in the area of screening in the schools. She's my go-to source. Dr. Eklund has toured the country. She's consulted with school districts. She's written books, papers, all kinds of wonderful things you could read. We'll certainly hear more about it. We'll get into some of the resources. But without further ado, I want to introduce my good friend, Dr. Katie Eklund. So Katie.
Great. Thank you, John, for the nice, warm welcome. Certainly is nice to be doing a presentation with someone you know and have known for a period of time. So thank you for inviting me to be a part of this series. As John mentioned, I'm here to talk about universal screening for mental and behavioral health in schools, also known as behavior screening or mental health screening in schools, and happy to be with you all here today. My home and my heart lives in public education. I worked in schools for 10 years as a practitioner and as a school administrator, and just feel very lucky to be able to continue to partner with schools as we help address the mental and behavioral health needs of students. So I'm going to quickly go through a 101 overview of what behavior screening is, the research to support it, how we've used it in schools, and then just quickly address some of the procedural questions that often come up. And then we'll spend the bulk of our time responding to questions that John might have and answering any questions that you might have. So as John alluded to, we know that the current state of child and adolescent mental health has been defined as a public health crisis. In our lab, we talk about this 2020 phenomena that 20% of kids have some type of mental or behavioral health concerns during their time in school, yet only 20% of that group actually receives help and support for those needs. And so we have a large gap between kids who have needs and those who are actually receiving help and support. We also know that those concerns have skyrocketed during the pandemic, and those rates are much higher, as John pointed out. So certainly important for us to be attuned to the needs of our students in schools. We also know that students who have behavioral and social emotional needs have more challenges in school in general. So lower academic achievement, oftentimes are kids who are receiving higher rates of suspension and expulsion, not coming to school, not completing school, and longer poor psychosocial outcomes. We also know the other end of that continuum, when we think about this dual factor model of mental health, is really social emotional wellness or mental wellness. And so this is what we want to promote and work to instill in our children. We know that improvements when kids are feeling mentally healthy and mentally well, they tend to do better in school. They're more engaged in school, have better study habits, and certainly are more motivated and committed to being there. And so when we think about social, emotional, and behavioral competencies, certainly I think when we think about school achievement, we often focus on high quality classroom instruction or the content knowledge of what kids are learning in school, and that can lead to academic skill growth. That's where we see improvements in academic achievement for kids. However, we know that oftentimes there can be barriers to learning. There might be reasons why kids aren't being successful at school, and it's not often just because of difficulties learning their content area subjects. Right. And so we see social, emotional, and behavioral or SEB competence as being a mediator that oftentimes when we can focus on the mental health and wellness of our students, that can help them be more engaged in school and lead to that academic skill growth and academic achievement. But when kids are struggling in school and when we might see behavioral and mental health concerns, it's important for us to make the link and be able to identify those students early. If you all were sitting here with me in person, I would ask you, what are the most common methods if you're working in schools of identifying kids who are struggling? And we know from the research that it's teacher referrals, that teachers tend to know their students best. They spend a lot of time with kids in the classroom and oftentimes can see if there's a significant change in a student, how a student shows up to school. We also know that there are other ways that we find out about kids. I like to joke when I was working in the schools, I received a script from a pediatrician saying, please put the student on a 504 plan, right? And sent that to school. And many of you probably have similar stories where you have a parent who's talking to their child's primary care physician and maybe noticing some concerns, or the doctor does, and ask the school to get involved. And so schools really, as we know, when kids access mental health services, they're most likely to do that in school. And so thinking about ready-made referral pathways we have in schools, such as school-based problem-solving teams, when we have school psychologists, school social workers, school counselors who are available to provide mental health support, sometimes even our school nurses, that we see an increased rate of referral and identification of kids who have those behavior concerns. And then certainly when we have high quality family school partnerships, knowing that parents feel comfortable to come and share with us what those concerns might be, that often can trigger a referral as well. However, we know if we have sole reliance on teacher referral, that can be problematic as well. In schools for a period of time, we've relied on this refer, test, place model, whereby a student has a concern, we might assess them and consider, are they eligible to receive services? But when we have sole reliance on maybe teachers, sometimes that can be challenging because we know teachers have different go through different pre-service training programs. Their teachers might differ in their ability to work with different kinds of students. And we don't necessarily always train teachers for them to know how problematic a behavior must be prior to referral. And so it's important for us to be thoughtful about what are our needs assessment data to make those decisions about which kids need help and support. We also know because of these problems and challenges in schools that kids' behavioral and emotional concerns can be referred and referral is delayed. So within schools, those of you who work in schools know about multi-tiered systems of support that universally about 80% of kids will be successful with universal supports that are in place. And we've had systems of support in place like PBIS for a period of time. The goal of PBIS would really be to decrease externalizing problems, some of those more acting out problems that we would see in school, with a goal to increase more positive or pro-social behaviors. So certainly that's been a tiered support that's been in place for a period of time. We've also seen an increase in social emotional learning programs within schools, thankfully, and know that well-integrated SEL programs can lead to decreases in internalizing problems and an increase in social emotional skills. So certainly, even when we think about screening, we're really focused on these universal supports first and foremost, and then really thinking about who are those kids who might need more of those targeted or tier 2 supports. And this visual here highlights a little bit more around where PBIS lies and how SEL can support students at each tier as well. So universal screening is one strategy by which we would screen all students in a classroom, in a grade, at a school, to really determine in a public health model which students might be demonstrating significant concerns. The goal is to identify those behaviors that might be concerning and to develop more of a structured way for us to consider the needs of all students. I remember one of the first middle schools I worked at, my supervisor, this is when I was an intern, said, Katie, I want you to go in the hallway and see what students you think need someone to talk to. And if any of you've been in a middle school, like all kids could use someone to talk to, right? Like middle school is this really challenging time. And so I don't know if like that in itself is the best way to screen or identify kids who have those concerns, but certainly using a structured or brief rating scale And having a teacher maybe screen students in a classroom or having students complete a measure assessing their own functioning can be another way or indicator for us to know are students struggling and experiencing some type of barrier to learning that warrants our concerns. So, or warrants concerns, and it is a signal that we need to get involved. So there is a lot of research on universal screening, and I'm not going to spend time today going through all of it, but just wanted to highlight a few points here. Screening is predictive of longer term outcomes for kids. So when we think about screening, we know that it can predict years later which kids were involved in mental health, special education, or juvenile justice. Some of our research using the SABRS, or Social, Academic, and Emotional Behavior Risk Screener, showed that fall screening scores were able to predict which kids were having difficulties with reading, office discipline referrals, and student absences at the end of the year. And some of the work we've done with the BASC-3 BEST, the Behavioral and Emotional Screening System, a shorter form of the BEST or BASC, for those of you who work in schools, using the teacher-rated measure, it could predict a substantial range of outcomes a year later, including which kids might be having conduct problems, social skills, concerns, depression, and difficulties with academic achievement. And screening research has really picked up over the last 10 to 20 years, and we're seeing real utility in its ability to identify kids. But I know often when we meet with schools, the first concern is this going to identify 30% of my kids? You know, I work in a district that has a lot of needs, especially after the pandemic. We're really seeing an emergence of mental health concerns. I'm worried that if we screen students, will we identify a large number and not have the resources to help and support those students? So I wanted just to quickly share a brief case example of a school where I worked. And this was an elementary school. And we had, I'll just briefly go through this. We had 600 kids at our school. You can see the demographics of the school on this slide. It was a K-5 school. When we screened students in the fall, of our 600 kids, we ended up identifying 62 kids as at risk. And this was using the SRSS, the Student Risk Screening Scale, another measure that's out there. As a team, so as a school mental health team, myself as the school psychologist, our school counselor, some of our administrative team, we sat down and went through that data and said, you know, which of these kids do we know about? Which of these kids are already on our radar and potentially receiving services? And we found about 2/3 of those kids were already in counseling groups, were potentially in special education, had some type of service in place. And about 1/3 of those were new to us. And so we needed to gather some additional data to determine what to do. And I think that's an important point. You know, screening is not diagnostic. It's not meant to tell you, you know, what type of concern necessarily, you know, it doesn't diagnose ADHD or conduct problems. It's simply a red flag to suggest, hey, this student might need additional follow-up or support. And so we really were interested in looking at over time with these 60 students that we had identified, putting services in place, did we see a decrease in concern? So this slide right here shows of the students who were not at risk, what their average rates of office discipline referral data was, the number of days they missed at school, and their GPA. And then in the red were those students we did find at risk. So you can see, obviously, many of these students had higher rates of ODRs. They were missing about twice as much school and this was data from the previous year, and their grades were slightly lower than their peers. And so at that point, we made some decisions. We looked at grade level data to determine were there pockets of risk or areas in certain classrooms where we saw a higher number of students who came up as at risk. We also, as you heard, looked at individual student data and began to really think about what services did we have available that we could provide to those students, and then in which cases did we need to add new services for those kids. And so we put those services in place over the year. And at the end of that first year, looked at, again, this data in the red. So this is a different group of data. It's just for the kids in that at-risk range, those 60 kids. We monitored them from the year before to the end of this year where we put services in place. So the red is their pre-intervention data, and then the blue is their data at the end of that first year. And what we found was with services, right? Many of these students had fewer ODRs at the end of the year. They were coming to school more often, and we saw a slight increase in their grades, even over that 1 year, with the hope that that would be increased or improved over time. And so really, again, thinking about if you're engaged in screening, hopefully the number and percentage of kids that you're identifying each year will start to go down. And so of the 62 students who had screened positive, when we did screening again, we identified 48 of those students, 48 students the next year. Some were new students and some were those we had identified before. So seeing those numbers go down over time was also super helpful as well. So certainly for the purposes of today, we don't have time to go into great detail on a number of the universal screening measures that are out there, but if you're interested in learning more, wanted to highlight a few of those measures that are available. Some of these are free and some of these have a cost associated with them. The 5 that are up here are highlighted because there is strong psychometric evidence to support their use within schools. And so just wanted to give you examples of 2 of them this evening. One is the BASC-3 BESS, so the Behavioral and Emotional Screening System. This is a part of Pearson. This is defined as a teacher rating of all students on common behavioral criteria. And the item pool is derived from the BASC-3. It is a short screening measure that has 3 different forms available, a teacher, a parent, and a student self-report form. It's anywhere from 25 to 30 items, depending upon which version you use. And it typically takes about 1 to 3 minutes to complete. So when you think about screening an entire classroom of students, we find that that can be done anywhere from 30 to 45 minutes to have all student or to have a teacher screen each student in their classroom. If you're asking students to fill out the report, typically that's done in even 10 to 15 minutes once it's passed out and completed by students and returned. So the scores that you see here talk a little bit about the subscale scores that are available. There's an overall behavioral and emotional risk index that comes through on the BESS. This stands for teacher, parent, and student self-report forms that are available. So all 3 versions have an overall risk index. And then depending upon the version that you're using, it also provides a subscale score. So that can be helpful in determining not only is the student at risk, but in what areas are they being flagged for additional follow-up. So if you're doing the student self-report measure, you certainly can look at internalizing risk if a student's endorsing that, hey, they might be experiencing more feelings of anxiety or sadness. There's also a self-regulation index and then personal adjustment. So provide some additional information other than that overall risk. And then a second measure is the SABRS, or the Social, Academic, and Emotional Behavior Risk Scale, which is now a part of FastBridge. So if any of your schools are using FastBridge, SABRS is available as part of that. Both of those measures, both of these 2 measures I'm highlighting have a cost associated with them. So that's schools will want to consider that in adoption as well. This measure is 19 items. There is a teacher version and a student self-report measure, and it provides, similar to the BESS, total behavior score, and then 3 subscale scores. So assessing students' social behavior, which really looks at externalizing problems and social skills, students' academic behavior concerns, looking at attention, and what we refer to as academic enablers. Are kids engaged in learning? Are they motivated at school and want to come to school? And then emotional behaviors would be more of those internalizing behavior concerns. We also would encourage schools to use this data and align it with extant data that they have available already. So by no means would I recommend that decisions be made using one single source of data in schools. Schools have lots of data available already. And so certainly aligning behavior screening data or mental health screening data with aspects like attendance, which I think is a signal for many kids that there could be other concerns going on, and other academic outcomes, which are highlighted here, and then office discipline referral data. So certainly thinking about how do you combine data to get a better picture of how to help support a student, which is ultimately our goal. Screening also should be used to inform not only child level considerations, but also systems level concerns, and want to walk you through a model here, which I think can be especially helpful. I also, as I started the presentation and really thinking about if you're working in a school that has multi-tiered systems of support, your first concern should really be looking at what is our overall percentage rate of risk at our school, and thinking about some of those universal level considerations. And then using that data to think about tier 2 interventions. But in many schools, and certainly places where I've worked, is asking yourself that question: how do we get to tier 2 efforts? Is tier 2 intended as prevention, right? Or is tier 2 another name for pre-referral documentation, right? And Kimber Van Nest, another screening researcher who's at the University of Vermont, had this question, and I just thought it was so important to think about, right? And it was so right on point, that I've been in schools where it's like, has it been 6 to 8 weeks? We've been doing our progress monitoring data. Can we hurry up and test the student so we can get them some services in special ed? And not that that's wrong or a bad, operating practice, but because I think at many schools, that's how kids access services, and that's how students get access to supports. But really thinking about, if we're there to support all kids, what might be a better way for us to do some systems level change, and think about tier 2 as really being that early intervention approach. So when you're using screening data, and again, when I present on screening, it's usually at least a half day, sometimes a full day presentation. So I'll try to give you the nuts and bolts of the slide here before we wrap up. But really thinking about using your data to guide interventions. I joke that in school, we do a great job of collecting data. We don't always do a good job of using it. So I wouldn't encourage you to take on screening unless you have a plan for how you're going to use the data that you'll be gathering. If your screening data comes back and you find that over 20% of your kids are at risk, the first consideration that your team should be thinking about and talking about is, what are those school-wide interventions? What are those tier 1 universal practices that we're using to support all students? And this school-wide base rate is a fancy way of saying percentage of risk, really looking at what percentage of kids can we provide services and supports to, and how is our universal systems supporting that. At the same time, and concurrently, also looking at class-wide percentage of risk or class-wide base rates. If over 20% of our kids are demonstrating concerns in a specific classroom, really thinking about classroom-wide intervention. I like to use the example when we think about academic screening data of, if we were to give an oral reading fluency assessment in a classroom, and we found that 15 out of 25 kids were below grade level in reading, we wouldn't be pulling 15 kids out for small group instruction or for one-on-one intervention, right? We would be pushing services in, or thinking about, what do we provide for all kids in that class to help those students improve in their reading fluency or comprehension, or whatever area we have identified as being a concern. I think we need to also consider our behavior screening in a similar fashion. Certainly, there are many reasons why a classroom might have a high percentage of students who are at risk. I remember working with a second grade teacher at one of my elementary schools, and she was so good at working with kids who others would find maybe more behaviorally challenging, or kids who needed extra support, that as a school, many of the students were placed in her classroom because she was very good at meeting their needs. And so sometimes those rates exist because of concerns that are present. And other times it's a signal for teachers to say, hey, there is some classroom management needs in this room, and I need help and support because I have a number of kids here who have those concerns. And so being thoughtful about those classroom-wide supports as well. And then certainly in the far right here, really looking at if we have a lower percentage of kids at the school-wide or class-wide level, at that point, really thinking more systematically about some of those tier 2 individual or small group supports. From an equity lens, right? Working with students from minoritized backgrounds, it's important that our screening data, similar to other data we gather in schools, isn't disproportionately identifying kids of color or kids from other minoritized backgrounds, right? And so just a couple points here. The quality of information into the system, right, is directly related to the data produced and the decisions that follow. So making sure that you're selecting screening measures that have assessed this, that have accuracy as in terms of sensitivity and specificity, and are they identifying the right students? Do they look at that based on race and ethnicity? We also know that it's really important to train raters, educators, and students in the content and purpose of screening. If we're asking teachers to be the primary informant, we certainly want to look at disproportionate identification. What are there aspects of implicit bias that might be impacting teachers' ratings of students, and having a pulse on what those data look like within our school? And then finally, really looking at disaggregated data by different student groups. We certainly want to be able to identify some of those inequities in our system as well, if we're engaged in a wonderful universal screening process. So just a couple limits that I'll highlight, and then certainly want to open it up for questions. Certainly decisions that are made based upon screening data should be defensible and consistent with the intended and validated purpose of the screener. Not all screening measures are created equally, and they have different content. So it's important for schools to really identify first and foremost, what do you want to screen for, and how are you going to use these data, and to pick a measure that is matched to your need. There are some screeners out there, for example, that ask questions around suicidal ideation. And if you're going to screen and include a question with that high risk of behavior, that it may change the screening outcome and would require your school to immediately follow up if students positively endorsed an item like that. And so really important to think about the content of your screening measures before you screen. Many don't, but there are a few that do. And then just a few other points. I mentioned screening's not diagnostic, treatment utility for different types of decisions, and then really, again, using multiple sources of data. So I'll go ahead and turn it over to John, and happy to answer any questions that you have.
Wow. It's a lot of information there, Katie. Why don't you drop your screen down? You could stop sharing your screen, and let's have a little bit of a kind of a dive in on some of these issues. I mean, so many questions come to my mind as I was listening to you. And I want to come all the way back to the beginning, where you talked about students who have unaddressed social emotional behavioral issues and the outcomes for those students. And unfortunately, we know if the social emotional behavioral issues are not addressed, unfortunately, the outcomes are really not positive, either academically or actually even later on in life for many of those kids. And conversely, you talked about the kids who do have the ability to have their needs addressed, develop that sense of social emotional competence, wellness, and the positive outcomes that come in there. Can you talk a little bit more about this link between social emotional behavioral factors and outcomes for students?
Sure, absolutely, John. We know absolutely it's important for students to gain effective coping and problem solving skills so that they know how to address adversities that they might be experiencing in their life. We know that kids who have more SEB competencies, social emotional and behavioral competencies, are those who go on longer term to pursue post-secondary or other vocational training opportunities. These are students who have higher rates of employment. They have higher earned income over the long run. And so certainly I know there's been a big focus on schools around SEL instruction, making sure that kids have those needs addressed and are learning some of those coping and problem solving skills as a way to really decrease higher rates of mental health and mental illness concerns later in life.
Yeah, and for me, Katie, I think that goes directly to the value of doing screening and making sure that we're identifying students who have these needs because of exactly what you said. If we're able to address, we're actually changing the trajectory of their lives at times.
Yeah.
Not to be overly dramatic, but I think that that's a really, really powerful concept for us to embrace and, recognize that we, truly can make a difference in kids' lives.
Absolutely.
And as I think about the screening process, and you were kind of talking about it before, in terms of teachers and teachers' perceptions of students, I know that we're all influenced by our experiences with others. And so for me, it makes sense to recognize that teachers are influenced by their interactions with students, by kind of what we see on the outside, at times. But I also kind of worry a bit how sometimes those perceptions can influence or maybe even have them misinterpret students' behaviors, particularly those that are struggling with social emotional behavioral issues. Can you talk a little bit about how sometimes we might misread or misinterpret behavior based upon what we see on the outside?
Yeah, absolutely. I think it's easy to misinterpret behavior and to go with what we know and what's familiar. For example, if a student shows up late to class, it might be easy to think that they don't care or that school isn't important to them. But I think it could be that a child was late because they were home taking care of a parent or a family member, or they didn't have a ride to school that day because their parent had to work, or, fill in the blank for whatever the reason might be. And so, I certainly am a big advocate for helping teachers build relationships with their students and to establish rapport so that we can better understand who they are as an individual, and that we have a better context for behavioral changes that might be occurring in their life. One of the assignments that I've implemented in a graduate course that was shared with me by a colleague is to have students write an educational autobiography paper where they describe their experiences with schooling. It's not meant to be long or difficult, but really a way for them to communicate with me what their experience has been in school. How have they interfaced with the educational system up to this point in their lives? And I've seen other classroom teachers do that. If you're, for example, a high school history teacher like my sister is, certainly you might want to know more information about a student's experience with maybe history, but even other educational subject areas. So you know what might be challenging or triggering to students when they're stepping into your classroom, or what might be happening in their personal life. And so opening that door, that window to a student, for you to get to know them as a person, I think can certainly help us maybe not misinterpret some of that behavior that could be happening. And certainly I gave one example. I'm sure there are hundreds of other examples that it's easy for us just to go with what we know, but really learning skills of empathy and connection with our students and trying to understand and be able to walk in their shoes to know more about who they are as a person, I think is certainly important.
I couldn't agree with you more, Katie. I know that you know this about me, and I've said this before in these conversations that I truly believe that relationships are the basis of everything that we do in schools, whether it be a school psychologist, administrator, an educator working in the schools. Those relationships that we build with the students just so critical. And so, getting to know the students is very important. But we are influenced at times by implicit biases. You kind of mentioned it, towards the end there, and I think for me, one of the ways is to use standardized instruments that will help to kind of cut through some of those biases that we all have, and we have to just acknowledge we all have them. But do schools have to use screeners? You kind of talk about some other data that maybe schools can also use. Can you kind of expand upon that a little bit more, Katie?
Yeah, I mean, there are a number of other sources of extant data that schools have available. Many schools use, for example, office discipline referral data or suspension expulsion data to identify kids who are having concerns. And so certainly that can be helpful. We know that ODR data tends to highlight more externalizing behaviors, so it may miss out on more of those like internalizing concerns. And if we're not maybe asking students about some of the challenges that they're experiencing, then we might miss out right on certain types of behavior. I think there's other pieces too that could signal something is going on for a student. So attendance, lower grades, other types of behaviors that we would see. I think that the piece of screening that I'm a big advocate for is just, again, if we can use students and get their opinions and learn from them, if this is a quick and easy metric, that can really complement some of the other pieces or sources of data that we do have available. But again, really thinking about that, as school psychologists, we know you don't look at one test score, you don't use one source of data. So I really advocate for schools to think about it in a broader picture of everything else that you do have available.
Yeah, we sometimes hear the phrase early warning systems.
Mhm.
And schools developing early warning systems, and it's really just it's data that's collected, and what is the data telling us about the students, and certainly screening data is part of that early warning system. But I like what you're saying, that we really need to look at the broader picture and look at pieces of data, and I think that that's an important piece for schools to really think about, because um, at least in conversations that I've had, sometimes when we talk about screening, they only think about, well, what screener are we going to use?
Yeah,
And that's important, and we're going to get into that, in terms of what does that really look like. But I think it's also important for us to broaden that view to say there's lots of data points that we really can look at to help us as part of that early warning system.
definitely.
Yeah. So, I've seen you give your workshop, and I know you get into this in much more detail. But as we talk about screening, there are kind of what I like to call different phases of the screening. So we kind of screen the entire population, or a class, or whatever the target population may be. Um, but it doesn't kind of just end there. It's not where we get scores and there's like a cutoff, and then all of a sudden we go from there. Can you talk a little bit about the process, Katie? Kind of maybe give some of our audience a little bit more flavor for what that screening process really looks like, from the cutoffs to a kind of another round of screening that might occur, just so they get a sense and what it really looks like.
Yeah, absolutely. I mean, I think so we'll put this up here a little bit later, but we have a screening procedural document that walks schools or practitioners through the different steps that you might consider when you are engaged in screening. And that's on our SMHC website, smhcollaborative.org. And that document, I think, is helpful for schools to understand. It's not just purchasing a screening measure and administering it and then using data. It's really thinking more broadly and talking to your teachers about, why are we doing this? What's it intended to serve? What purpose? What additional answers and data can it provide for us? I think that messaging can be really important to think about. Are we screening at our school? We screen for vision, we screen for hearing, we screen for academics, and we also care about behavior and mental health concerns. And so having that be part of the broader framework of, how do we identify barriers to learning in our school? And that we are all means all. If we care about all kids, then we care about them as an entire person and human being. And so thinking about, what are those different aspects of functioning that we want to make sure isn't keeping them from being successful in class? And so having those conversations with teachers, having conversations with parents, linking it to broader data that we have available. I think parents are very aware right now of the mental health challenges their kids are experiencing, and seeing that at home, as they were working to implement virtual learning and at-home instruction. And so certainly, I know at our clinic on campus, we've seen a huge increase in referrals and parents who are trying to access services in any way possible. But when they can see that link between behavior and between academic functioning, I think that really helps increase buy-in and an understanding of why we want to know about these concerns early on. So in that screening process, making sure that buy-in is possible, scheduling a time for it to happen, certainly thinking about some of those nuts and bolts. If you're, going to have your teacher screen, certainly I think the do it on your own time approach probably isn't going to give you the most effective data. If, a teacher's at home trying to have time with their family to ask them to screen their classroom, probably not as effective as could we provide some time at a professional development day or at one of our staff meetings where we take a half an hour or 45 minutes and have teachers give us some good high quality feedback on their students? Or can we take 15 minutes out of an advisory period or homeroom period and have our students share with us, what is your experience? How are you doing? Talk to us about what's going on for you. And then again, ahead of time, before you're at that point, really planning for what are we going to do with these data. I also like to highlight there are screening measures out there that are free, but I think free means at the cost of somebody else's time, right? That it can take time to aggregate those data, to input numbers into a spreadsheet for, and usually that's the school psychologist or social worker or counselor, maybe administrator, who already doesn't have a lot of time to put that together. So there's still a personnel cost involved, and it's important for schools to think about that. And that's expensive in its own way. I know schools are very used to spending money on academic data, maybe not as much on behavior. And so really thinking about, is this a good use or source of funds for us to consider? And then really planning ahead of what are we going to do with these data when we have them? What services do we have in place? I've seen some schools use this as a way to advocate for additional services at their school. So, you know, if they're screening and have a high percentage of kids, do they need additional mental health support? Can they take these data to their school board? Or when funding decisions are being made, think about reallocation of resources. So, you know, John, you and I have done plenty of advocacy work together. But I think that local data from a school speaks volumes compared to this, you know, a national percentage. When you see that it's your kid's school and that these are kids in your community who might be struggling, I think it changes the language around how we want to provide supports and what we want to spend money on.
No, I love that. And I love what you just said, Katie, because it speaks to my heart right now about using this data really as part of advocacy, but part of planning as well. It's the proverbial, we don't want to be constructing the airplane in mid-flight. And that's what's happening right now in many schools. We are inundated with kids who are struggling. We are really seeing the impact, not only the pandemic, but everything that's been happening in our country, more global events that are currently existing. And yet we're trying to construct that plane in mid-flight at this point. And so by screening students and identifying them, it gives us an opportunity to really be able to do some of that planning and yes, advocacy. So I love that piece. So let's dive a little bit into kind of screening, and I'd like to hit upon some of the big issues, and get your thoughts on some of the big issues that we often hear as relates to screening in the schools. And Katie, you know it as well as I do. One of the biggest issues relates to parent consent. Excuse me. Do we need parent consent to engage in universal screening in the schools?
Yeah. The Wisconsin Department of Public Instruction, which is our local Department of Education, put out some guidance actually that I read before I even moved here, and really highlighted when parental consent is needed and when it's not. And I found that this aligns with other state laws. Because screening data, many of the screening measures that are out there that have been validated and normed for use in schools ask about school behaviors that you would see at school. And it's customary for teachers to assess student behavior in their classroom or to address aspects that could impact learning. And so their interpretation has been, and again, in many other states, that if teachers are completing measures on students, that passive parental consent is appropriate, meaning you want to inform parents that this is happening to give them the opportunity to have their child not participate or to opt out. But that in moving forward, you can move forward without having to do active parental consent, where you would need to have every parent sign a form for their child to participate. It just, and that's when using teachers. If you're having students give self-report data, again, you would want to check the types of questions that you're asking about. But in many of the measures that we highlighted on this call and that were part of the presentation, most of the guidance suggests that as long as kids have the opportunity to opt out, they're not required to participate or forced or incentivized to participate, that again, a passive parental consent process or opt-out process is appropriate. And I've seen many schools, and that might be the initial time that you do it, or it could be every time thereafter. There have been schools that we've worked with as well who've written this into their student handbook, or who have integrated this into other types of screening, like vision screening, hearing screening, academic screening, and have behavior screening as part of their student handbook, which at any point parents can opt their child out of. And so have moved to a more systematized process of implementing universal screening in their schools. So that's typically been what I've seen with consent.
So correct me if I'm wrong in this, Katie, but my understanding, and you really hit upon this, and this is why I want to highlight this. The questions that we ask as part of the screening are critical. Because my understanding is that federal law allows us to, ask, as you said, questions about students and the normal course of business within the schools. But there are certain areas where the law recognizes we need parental consent to gather information in certain areas. And so I guess the key piece is, and as you said, many of the screeners that you've talked about, we're going to talk about in just a moment, really tap into areas that look at the normal course of business during school. And so the passive consent is sufficient there. Yes, we want to notify parents we're doing this, give them the opportunity to opt out, but the passive consent is generally sufficient that's there.
Yeah, definitely. And I think the reasons why is it's universal. It's something we're doing with all kids. If we do something that's more targeted or more diagnostic, at that point, you would want to obtain active parental consent for sure. But I think those tend to be the key differences.
Excellent, excellent. So another big area is teacher buy-in. And I know you've done tons of consulting work across the country, many school districts, but we always hear, oh, this would be great, but I just don't have the time to do it. I don't, I can't fit it in my curriculum. How long does it really take? I mean, I know you kind of touched upon this, but what are some tips in terms of really getting that teacher buy-in?
Yeah, I mean, I think just oftentimes teachers are used to referring kids for behavior concerns. And I think as long as there's services available at their school and somebody that they feel like they're referring them to, but I think helping teachers identify or explain to teachers that this is a way for you to be able to share more with us about each of your students and for us to have a better gauge on the needs of all of the kids in our community. And I think framing screening in that way, because I think that's what it is, certainly can be helpful in teachers understanding why they're doing it. Typically, it takes about 1 to 3 minutes per student. For students they don't have concerns about, it's quick and easy to complete a measure. For students where there might be some concerns, they might take a little bit more time to consider their responses to questions that are being asked. But traditionally, we find that teachers in classrooms usually can screen their entire class of 25 to 30 students in about 30 to 45 minutes.
No, and I really appreciate the points you'd made before about let's not ask our teachers to do this on their own time, to do it at home. But really, if schools want to be serious and get valid data, that's an important component for them to really embrace, that we do dedicate the appropriate time for that. So no, I think that's a great point. The other thing that for me, you talked about how some screeners ask for teacher feedback and teachers to rate the students, and other screeners might look more at self-ratings, students kind of rating themselves. Do you have a recommendation regarding, is it better to have teachers rate? Is it better to get student feedback? Does it matter? What are your thoughts in that area?
Yeah, good question. I would say if you have students that are old enough to self-report, I think that's a really valid and wonderful source of data. We find that children are really reliable sources of information about themselves. And so, as you think about upper elementary school, middle school, high school students, I think that really goes right to the source and gets data back from students. Obviously, if you have younger kids, reading considerations, right, might be might need to be considered. And so in that case, certainly teachers would be accurate informants of student behavior. First grade teachers who've been in the classroom know normative behavior for first graders, and so can usually provide really reliable data that's helpful to look at. But I tend to lean a little bit more towards the student self-report data, just because, especially with teenagers, as we think about internalizing behaviors, especially, it can be helpful for them to provide that information.
Yeah, I have to agree with you. I remember within my own school doing using some of the youth risk behavior surveys, and really looking at the data and using that data to help us do some planning. And I really was impressed with the self-report data that was coming out of that, and the insights that we can really gather from that. Now, I do work at a high school, so to your point, certainly it is for some of the older students, but I do think that there's value there in really honoring and respecting, from a student's perspective, kind of what they perceive their needs are, and identifying the issues that are important to them.
Yeah. And I said, John, I just wanted to highlight, I was just looking at the chat of questions. Somebody asked about language proficiency. I don't know if you're thinking about students too who might not speak English. There are some forms that are available in Spanish and other languages, depending upon what measure you're looking at. So that might also be a consideration in terms of access.
Yeah. So Katie, this always happens every week. We this hour goes by so quickly, but I do want to get to a couple of other issues that I think are really important. You tapped into this whole concept of, if I screen, then what? I identified 30%. I think you use that as a figure of my population. My God, what am I going to do? What do we do? And I know you kind of talked a little bit about this, but can you talk, more about, it's really not identifying 30%, because more often than not, we're going to identify kids that we already know, but it's uncovering students who we may not know. Can you talk just a little bit more about that fear?
Yeah, it's a good question, John. And I alluded to this earlier too, and I don't think I totally spoke to it. None of these measures have been normed during a pandemic too. And so I really think about the data schools are getting back now compared to 2 years ago. And how does that look? We're working on some of those analyses right now with our research team of how have rates of mental health concerns changed based on screening data, and really seeing an increase and an uptick. So I think it's important to take that into consideration, that those rates might look different right now than they do next fall, than they do a year from now. And what are those environmental or contextual factors that might be contributing to that? But I really encourage schools to think about, is this, many schools don't have a high percentage, if there are these mental health needs, don't have enough mental health providers, as we know, to meet those needs. And so being able to contract with local service providers, certainly community mental health partners, finding ways to get some of those additional services. But again, as I highlighted before, I think a lot of those universal supports for all kids, can we think about, is there an SEL curricula that we need to implement within our school? Are we seeing an increase in internalizing concerns where we know all kids would benefit from learning more coping and problem solving skills to address an increase in anxiety, or an increase in, I'm used to being at home, I don't want to go back to school. How do we reconnect? I find that way sometimes in social circles, how do we reconnect and get out of some of those routines that we've established over the last few years? So that data sometimes can be helpful, again, in thinking about what might be those universal practices that we can implement that are going to have a benefit to a larger percentage of our population than they might have otherwise, based on some of that demonstrated need. And are there additional services that we can contract with and think about to help meet some of those demands, based on resource challenges that we might be experiencing in our school?
Yeah, and I want to kind of jump on that just for a quick moment, and not because we are sponsored by eLuma, which is a virtual provider that's out there, but there's a question in the chat box about the effectiveness of telecounseling and the more virtual world.
Yeah.
And I think that for districts that are resource challenged, I think that the virtual services have become a very effective option for them, where they cannot hire people to come in, or they don't have the resources directly there in their community, being able to reach out to companies such as eLuma, or other virtual providers is certainly an option that is out there. I think
Yeah.
that's important to acknowledge.
Great.
So, kind of diverting just a little bit, but this is always, as we talk about an MTSS framework or kind of more an RTI, type of framework, can we use screening or screeners for progress monitoring?
We recommend really no. I mean, I think you can look at percentage of risk over time and see, is that changing from a population standpoint? But screeners aren't really sensitive enough to change over time. In a short amount of time, in like a 6 to 8 week period, you're not going to probably see changes on a screening measure, and so they really aren't recommended for use as a progress monitoring measure.
No, and I really appreciate you saying that, because I think that is an important piece. But to go back to your case study, let's look at the data that you did look at that did show change. And so there is data that we can look at as more of a progress monitoring. Screeners may not be the most appropriate for that piece.
Yeah, for sure. And I think if you're putting in some type of mental health intervention, in more of a tier 2 or tier 3 fashion, looking at things like direct behavior ratings, some schools use like SUDS ratings, or having students rate themselves on more brief measures. Those tend to be more validated for that purpose versus using a screening measure.
Yeah, 100%. So I'd love to close out the evening, just kind of giving you an opportunity. And I know you've prepared some resources for our guests, for our audience tonight. So I'd like to let you kind of reshare your screen and maybe walk through a couple of the resources that are available that are out there.
Great. Thanks, John. Yeah, we put together, so this website up here, I'm part of a research center called the School Mental Health Collaborative, SMHC. So that's at smhcollaborative.org. There is a document, the one here on the right, around best practices in universal social, emotional, and behavioral screening. If you're interested in implementing, it is at that site. It's freely available. It's put together by screening researchers from all over the country. We also have some other resources on here. I'm part of a group that developed a tier 2 intervention for internalizing behaviors. So if you're interested in that, I think schools are always looking for resources, but that screening guide has an implementation checklist and planning guide that'll walk you through kind of what John said from beginning to end. How are we exploring measures? How might we know if we're ready? What does adoption look like? What are some things that we should be considering? So this should help walk schools through that process. And then there's a number of frequently asked questions. So if you're part of a planning team and you have a teacher or administrator asking you a question and you're like, I don't know how to describe this, what is screening, or when is parental consent required? We've tried to include some of the more popular FAQs and provide some evidence-based responses to those. And then again, guiding questions activity about how you're going to be using screening data at your school. Also wrote a book this last year that just came out with 2 colleagues of mine on, if you're interested, on conducting behavioral and social emotional assessments in MTSS. And that has some additional guidance in there as well about what is screening and how to use it within a larger behavioral health framework at your school. So my contact information is on here. There's a bunch of resources available at this tiny URL guide, and then our website. Also happy to answer questions if attendees would like to reach out about screening. Always happy to engage and talk to practitioners as well.
So Katie, you're being a bit too modest. Go back to your book there just for a moment.
Oh.
This is the go-to guide. I'm sorry, I'm going to say it. I know that you're very modest, but Nate Von der Ems, Katie Eklund, and Steve Kilgus are 3 of the top leading researchers within this field, and this truly is a go-to guide if you're looking for a place to go to and really get from soup to nuts. This is really it. So I'll say, Katie, because I know that.
Thanks, John. No,
but I think it's a wonderful resource. So let me bring George back in. I don't know if we have any additional questions. I think we touched upon many of them already in the chat box. But George, was there anything further that we needed to address?
No, just wanted to thank the both of you. I thought that was a really wonderful session. And I think we've hit all the questions for the day, but Katie, we want to thank you specifically for taking the time to join us today. And we would also love to have you come back and
Great.
work with this. Seems to be a topic of great interest. I'm kind of curious to track and see how the video goes. And I want to remind everyone that's here with us, we will be sending you a link to the recording as well as the deck to this so that you can refer to it. But yeah, this was fantastic. Everything we'd hoped for and more.
Well, I appreciate that, George. And let me just say a quick thank you again. Well, this brings to a close office hours with Dr. John Kelly for the spring of 2022. We will be coming back, and we certainly hope to see you in the future for further conversations like this. So thank you again for joining us tonight.
And everyone, be sure to follow us at eLuma Solutions on Twitter. You'll stay updated with all of the latest webinar info, other great content. And if you'd like to learn more about working as a clinician, or you'd like to learn more as an administrator and how eLuma can support your school or district, visit us at eLuma.com. Thank you, everyone.